I'm Linda Elsegood, founder of the LDN Research Trust. It has been my honour to interview LDN researchers, prescribers, pharmacists and patients from around the world for many conditions. Thank you for joining us. Today we're joined by Dr. Nasha Winters from Colorado in the US. Thank you for joining us, Nasha.
Thank you, Linda. Really happy to be here.
Now, could you tell us about yourself? That would be a good starting point.
Well, my name is Nasha Winters. I'm a naturopathic doctor. I'm also a licensed acupuncturist and have a diploma in Oriental medicine. And I'm also a fellow of the American Board of Naturopathic Oncology. I did specialty continuing training in naturopathic and integrative oncology. And so I had run my own private practice for quite some time, and in 2014 sold my practice, stayed on board for a year in the transition, and as recently as 1 year ago, launched out to do consulting with doctors and clients around the world who really wanted to have more access to integrative approaches to oncology. I've been exclusively treating cancer patients since 2012. Even had to close my practice for a while because it was so inundated, and just reopened it this year for consultations. I'm no longer doctoring or practicing per se, but I speak to a significant number of clients and doctors who want to have a deeper understanding of how best to support their bodies through a cancering process.
Mm-hmm. And how did you get involved with LDN?
I was working for a long period of time. I worked with a lot of autoimmunity and endocrinology issues in Durango. And being in a very small, tiny town on the Four Corners, our closest city 3.5 hours away, I was sort of the local endocrinologist, literally, for about a decade. And I had a lot of patients with a lot of autoimmune issues, which we often see in this part of the world. A lot of mercury plants, coal-burning plants and whatnot, a lot of mercury exposure, thyroid dysfunction, you name it. So a lot of endocrine and autoimmune conditions. And I had a client who came in who she herself had a pretty severe multiple sclerosis and came in asking me about the use of this. She'd found it herself, and I think this is around 2004. And I looked into it. It was quite compelling and was able to find a doctor that was willing. At that time, we didn't have any ability to prescribe or order this even. And I was able to find a doctor who was willing to prescribe it for her. And what I witnessed in her own condition, she'd been in a wheelchair at that time. She was back to full life functioning within a few months. And it was obviously life-changing for her, but also for me. And I started to explore it more and started to use it in all my patients with autoimmune issues, even endocrine issues, hormonal imbalances, chronic insomnia, anxiety patterns, and started just watching. They kind of knew they were my guinea pig at the time because we didn't have a lot of information about it then. So clinically, I very much believe in empirical gathering of evidence. I started seeing quality of life and other conditions really change in folks. Started hearing little snippets about this probably in, 2008 or 9 about its use in cancer, but I was a little hesitant to use it in that arena until a few compelling talks I heard in 2010 and beyond that I started really using it in my oncology patients. And now I would say probably 80% of my oncology patients take this at some point in their treatment support.
And going back to when you were treating people with autoimmune conditions as well as cancer, when they first started, did any of them report to you any adverse effects?
Yes. I've had out of, I don't know, if I had to guess, I've probably had 1,000 clients on this over the years. And out of that, I can count on less than 2 hands how many people had severe, adverse effects enough to not be able to utilize this drug, because it's a drug. And that would be extreme muscle cramping in their legs, especially at night. And no matter how many adjunctive, supportive minerals, everything we did, hydration, magnesium, potassium, even IV drips, you name it, even cutting back on the dosage, it just was intolerable for them. I think that's a pretty minor, compared to side effects of other sort of off-label use medications I've seen, that's really not that many. I've had a few people who just couldn't tolerate it. Out of those 10, I think half of those just could not utilize this medicine. And that was across the board in patients with autoimmune and cancer. And in fact, I just had this experience with a woman with ovarian cancer who we tried every which way to utilize this for her, and it just simply was a no-go. It was so disruptive to her quality of life and her sleep, and the pain was intolerable. It was extreme. So once we pulled it out, within 2 nights, the symptoms were completely gone. We thought maybe it was a fluke, reintroduced it. Sure enough, there it was. She's by far had the most severe response of anyone I've seen, and she wanted it so badly because of the literature out there, but it's just simply not a match for her.
Mm-hmm.
Other folks have described, some sleep disturbances initially, but we just back them down and take it a little bit slower as we titrate up. And those folks with the adverse effects are able to build up their reaction or response to it and have no issues whatsoever and can maintain it for the long haul.
Mm-hmm.
I think I have 2 patients that needed to just stay at 3. Once they went up to 4.5 milligrams, they couldn't seem to tolerate that. But I've only had 2 or 3 that needed to stay at the lower dose. But for the most part, everyone handles the 4.5 milligram dosing beautifully.
Mm-hmm. And how long would you say it takes your patients to find that there's a benefit?
Great. So, first of all, I titrate pretty quickly because I'm staying in touch with my patients. Most of them go 1.5 milligrams for a week, then 3 milligrams for a week, then 4.5. I know a lot of doctors who go much slower than that, take each of those levels at a month. So in my world, most of my patients within a week or 2 have significant changes in their overall sense of well-being. We can see changes on inflammatory markers on their labs within a month for sure. We see improvement once they tolerate the dose that they're on. Their sleep completely reboots and stabilizes. We can even see adrenal stress index and circadian rhythm salivary testing to see that it does in fact have an impact on the circadian rhythm, which is pretty exciting to me in the world of oncology. And I'm trying to think of other significant factors. I'll do some hormone testing, salivary urinary hormone testing as well, 3 to 6 months into the treatment for folks that had, say, estrogen-dominant processes impacting their autoimmunity or their endocrine system or their oncology. And we see a big change even in the response of how their body is processing, storing, and breaking down hormone.
Mm-hmm.
Yeah.
So with your consultancy and all the knowledge that you have, what do you suggest for your patients, as in diet and supplements, and what should they be looking for?
Excellent. Well, because now I focus almost exclusively on oncology, although as you and I chatted before the interview, a lot of those patients also have autoimmunity processes going on, whether they had it before their cancer diagnosis or, as is often the case after cancer treatment, they'll have it then. So that process happens. But I'm a huge proponent of low glycemic. Most of my patients are, because I see mostly stage 4 cancer patients. Most of them are on a ketogenic type diet, low glycemic for sure, nutrient dense, organic. I'm very much a stickler for that because I'm also very interested in environmental medicine and the impacts of we are what we eat, but also what those animals eat. So if you're going to eat animal, you need to make sure it is clean, or frankly avoid it. I'm a huge proponent of mitochondrial reboot, of the sort of popular approach that Dr. Terry Walls put out there of the 9 cups of vegetables a day. So my patients really push a very vegetable-rich foundation to their diet, second by quality fats with condiments of quality protein, and sugar is pretty much removed entirely from the diet, including extreme limitation of fruit. Because I follow labs, not just a dogma of a diet. Once their labs improve, specifically in the realms of insulin growth factor, C-reactive protein, HSCRP for blood sugar, insulin levels, then we can start to increase their fruit intake again and their more starchy fruits and vegetables. I tend to, because I work with a lot of autoimmunity and leaky gut issues in the cancer population, I really keep them off grains. And so from the lectins and the inflammatory markers and the high starch and sugar content of those, they tend to be on grain and legume diets until their blood sugar stabilizes. Then we can reintroduce them, though I find that most of my patients do much better completely off the grains, and extreme limitation or even avoidance of the legumes as well.
That's very interesting. And supplements?
I try and do as much as I can through diet and lifestyle modification. Diet is the absolute foundation to this, but there are obviously a few key players, vitamin D being the biggie. Vitamin D is so huge in the world of oncology, autoimmunity, hormonal balance, blood sugar balance, inflammatory process. We have issues with epigenetics on how this makes our bodies respond to certain treatments. There's some theories out there that even vitamin D deficiency can be impacting our internal endocannabinoid system as well as our opiate system and how we respond. So why LDN is probably such a benefit as well as an immunomodulator. So that's a biggie. Oftentimes, depending on, I do SNP analysis in all my patients, so I look at single nucleotide polymorphisms, and I'll bring in magnesium a lot, which also synergizes nicely with the LDN. Works on the way our body processes hormones and stress hormone. I'm trying, it's so weird. I'll use supplements incredibly therapeutically depending on what the labs are saying. So an example, if they have high fibrinogen and a lot of inflammation, I might use proteolytic enzymes or things like lumbrokinase to work on lowering that. If they have high ferritin, which is actually more common than not in a lot of these chronic conditions, just because you have low blood count does not mean that's an iron deficiency anemia, then I'll do therapeutic blood draws if their blood levels are stable and their marrow is good, and then bring on other therapies that can lower the ferritin, such as avoiding red meat and cast iron and things like that. Trying to think of other examples. Obviously, blood sugar is a key. Hormonal balance is a key. Angiogenesis. I do a lot of work with natural angiogenesis inhibitors such as alpha-lipoic acid. And so I do a ton of work with low-dose naltrexone and alpha-lipoic acid, both oral and IV alpha-lipoic acid, using kind of the Berkson protocol that many people are familiar with. Especially if there's aggressive cancer and especially if there's liver metastasis.
And the good news is that you will actually do telephone consults, Skype, and all the other media that's out there. How do people get hold of you?
Great. And again, just to reiterate, I'm not diagnosing or treating. I'm helping you sort through all of your internal data and help you create a roadmap to get you into the exact, most perfectly fitted treatment, practitioner available to you wherever you are in the world. That's kind of my job now. But ultimately, you can reach me. Go on to www.optimalterrainconsulting.com. And you can, there's a ton of information about sources, resources, our book that's coming out the end of the year about a compendium on integrative oncology with a foundation in nutrition and diet, therapeutic diet. We actually do talk about low-dose naltrexone and other things in the book as well. So little plug for you guys. But that's one way. You can also directly email me at Nasha, Dr. Nasha, DRNASHA at optimalterrainconsulting.com. And you can also go on Facebook, where I put a ton of articles and blogs and information that I'm constantly skimming through and putting up for your entertainment and educational, which is just looking under Facebook for Optimal Terrain Consulting. So lots of ways. We take advantage of all the social networks if we can.
Thank you very much for joining us and educating us on how to make ourselves healthy.
Thank you. Fantastic. Love what you've done. Your book is a hit among so many of my clients and colleagues.
Thank you.
Thank you.
Do you have LDN experience to share? If so, please email me, linda@ldnrt.org. I look forward to hearing from you.